Hello everybody, my name is Dr. Tran. I'm a chiropractor, and today we're going to address a few of the myths that people have about chiropractor and what we do. So let me clarify it for you. Alright, so the first question usually people ask is, are chiropractor real doctor? And we have to go to school to get a 4th year of BS degree, and then you have to go for another 4 year of chiropractic school. So after 8 years of school, we are certified, so we have to pass through 4 parts of the national board exam to be able to practice, to get our license in every state. Yes, we're not medical doctor, but we are chiropractic doctor, so yes, we are doctor. All right, so the second question we need to address is seeing a chiropractor dangerous? Well, to me personally, I think every single service, every single therapeutic, there is a risk, but chiropractic risks are very minimal. And here's an example. I pay less than $1,000 for my malpractice insurance per year. On average, a medical doctor would pay $7,500 per year. A surgeon pays somewhere between $30,000 to $50,000 a year. And then the other fact you can also look up is the chance of getting injured from a chiropractic adjustment is lower than the chance that you get hit by lightning. But every service, every treatment you do perform, there is the risk and benefit. So you have to weigh between the risk and the benefit, that see if which one is more effective. Chiropractic adjustment, the risk is so minimal to the benefit that everyone receives. Do I get fixed in one visit? Absolutely not. The problem that we are dealing with is repair trauma, especially with the spine. We sit all day long. We have injury from years of sport. So usually by the time you go to see a chiropractor, your back is not just acute. It might flare up right now, but the problem could exist years ago. So you come in for one treatment, you get better, but there's no way you can fix it, because our bodies really get compensation. So anything you have, the first thing you do is compensation. So after we address the pain, the inflammation, we have to address the bad habit you pick up. So there's no way we can fix anything in one visit. Even antibiotic, 2 or 3 times a day for 2 weeks, 10 days, 5 days. So chiropractic treatment, each visit is one tablet. Nobody can fix you in one visit. And how many times did it take me to see a chiropractor get fixed? Well, depends on your condition. Everybody's is different. Because after I adjust a patient, I treat you a patient, you go back and use the body right away. Use your spine right away. So how fast you recover is dependent on how bad your body is suffering right now. Right, so the next myth we have is, do I have to see the chiropractor for the rest of your life? As long as you have your spine, you need to take care of the spine. So yes, you do have to see the chiropractor for the rest of your life. However, you don't have to see the chiropractor all the time for the rest of your life. Let's say if you have a acute back injury, you come in, you see a chiropractor 2 or 3 times a week until he fixes that back. Just like if your car breaks down, right? You fix it, but after you fix the car, you still have to oil change every 5,000 miles, 10,000 miles. Your body needs maintenance. But the thing that I think a lot of people confuse is you cannot maintain something if it's broken. So if your body is broke, if your spine have issue, then you have to address that by continuous treatment until that problem is fixed. And when it's fixed, after it's fixed, then you only go maybe once a month, one every 2 months, one every 2 weeks, depend on your uses. Just like your car, the more you drive, the more often you change your oil. But a lot of patients I come in and see say, oh, Dr. Tran, I have to sign up for 30, 40 visits. No, it's up to you. The hardest part that we have to deal with is we treating your spine. And you use your spine every second of the day. And computer and driving and poor posture put a huge impact on it. You come in, we do some treatment, we alleviate some tension, some pain, some lactic acid removal, but as soon as you go back to your daily activity, you put them back in again. That's what makes our treatment hard and difficult, and it sounds like it's repetitive a lot. But you can only get treatment when you're in the office. So yeah, the time you come in the office is more frequent. But like I make example earlier, each time you come in is one tablet of medicines. Same thing with us. You come in, depending on how severe your condition is and how often you use your body, then that's determine how often you have to be treated. And then when you fix that problem, you just need maintenance. Maintenance care is different for everybody. You drive a lot, you get more oil change. You drive less, you drive less. People are really surprised when they realize that we treat children. They say, oh, I thought you only treat adults. Well, no. Every single person that has a spine. Just because you're a kid doesn't mean you don't get your back don't hurt, especially with now, with new generation of a lot of electronic, a lot of smartphone, a lot of tablet. And imagine if you sit like this all day long, how much tension do you have in your back? Back in the day, you know, when I first practiced 20 years ago, my average patient was 55 and older. Now I have at 9 years old and I don't have back pain, right? So it's not the age, it's not how old you are, it's how often you use your back the wrong way. And then now a lot of children are very busy with a lot of schoolwork, but also with athletics activity. You know, when you sit and coop up and have poor posture, when you go out there and you play sport, you get injury, but we usually have them push through the pain. Well, how do you know if you hurt yourself? Are you overworked because you injure a muscle? Or it's just too much work? And then when they keep building it up over time, they definitely have issue with their joint and their spine. And that's why lead to not only poor physical function, mentally as well, because if your back is hurting, your spine is tight, your muscles tight, you don't have good blood flow, you don't have good oxygen. So yeah, children definitely need chiropractic more than ever. So if you have a child, bring them in. I can show you how bad, how poorly postured they are right now because of the way our society is running at this. And then one other thing that I get every now and again is, oh, my family doctor told me not to go to chiropractor. Well, that's one thing I don't understand. You know, when you have heart issues, you go to cardiologist. When you have kidneys, internal issue with your stomach, you go to urologist. When you have female issue, you go to gynecologist. So why you don't go to a spinologist or chiropractor when you have spinal problem? Who are better address your spine than the spine doctor? We go to school to study the spine. That's what we do. That's our specialty. So why don't you come and see us? I don't understand. And maybe this will help you if you understand it. Maybe you can answer my question too. Why don't you see a spine doctor if you have spinal problem? There's so many people who have back pain now. It's not a normal thing. It's a common thing, but it's not normal. So just because 9 out of 10 people have back pain doesn't make it normal. You don't have to live with back pain, because the side effect of back pain over time can create a lot more other problems that you don't think about. Your spine is your backbone. If your backbone is not healthy, how can you have a good, healthy body? So if you have spinal problem, who's better address it than the specialist on the spine? That's what I do. I learned the spine. I went to school, that's what I learned. Taking care of the spine, treating the spine. So if you go to cardiologist for heart disease, why not go to a spine doctor for spine? Chiropractor, that's what we do. We treat your spine. So the other thing I also have commonly addressed is, do the spinal adjustment hurt? Yes, sometimes they do. Here's what happens. If you haven't exercised for a while, you start going to the gym, you do an hour and then work out the next day, you're gonna have sore, you're gonna have ache. Same with the spinal adjustments. If your spine has been locked up for a month or year, so you first go to a chiropractor and you get adjustment, they might be sore the next day. However, that's why in here we not only address the adjustment, we don't do the adjustment right away. We have to use other treatment methods like acupunctures, cuppings, ultrasound to reduce the muscle tightness. Most of the joint problem we are facing is the muscles over you and they lock up the joint. At chiropractor, our goal is to try to free that joint from being locked up. But if you don't address the muscle first, you don't address the tightness first, and you go too forceful to the adjustment, that can cause some pain and discomfort. That's why we always address the muscle first. And then even after we get adjustment, you have to address the muscle afterward as well, because if you have bad habit from the injury or the pain and you don't fix that habit, nothing's gonna change. You get improvement, you get a short-term relief, but the real problem is the poor muscle coordination, the poor compensation, the bad habit that we don't address the injury right away that picked up. So that's why in this office we combine chiropractic, acupuncture, physical rehab. You cannot have one of those three things combined to correct the problem you're coming in with. So most chiropractic adjustments, you might hear the pop or you might not hear the pop, and it should not hurt. However, that area is inflamed, so they might be tender, but it's safe, and you shouldn't hurt afterward. But the next day, you get soreness. That's normal because your spine have not moved for a while, and now it's getting moving. Chiropractic adjustment doesn't always hurt. Sometimes it might be tender when we touch it because the inflammation along the spine, but it should actually feel better after the adjustments. Say, hey, if I can crack my neck and can crack my back, why do I need to see a chiropractor? Well, first of all, when you adjust your own neck, you crack like that. Only the middle joint, you have 7 joints in your cervical spine in your neck. So when you turn your neck like that, you only the middle joint that move all the time. Now you have 7 joints, only the middle keep moving over and over again, and you have the urge doing that because the stiffness is what called the discomfort. So when you crack like that, your body produces natural endorphin, so that's why you feel good. But if you keep moving the same joint over and over again, that joint will be unstable. Because the top joint has a lot of muscle attached and the bottom is close by the rib, you can't adjust that on your own. So when chiropractic adjustment, we actually put our hand anchor on where it needed it and use the top and the lower joint, and we move them. Same thing with the mid-back. You can't adjust your mid-back by yourself. Sometimes you put on a roller, you might have a crack here and there, but you remember you have 12 of the thoracic spine. And the same thing on lumbar, you're going to go like that. You might pop 1 or 2 down here, but same thing, it's the middle one that doesn't need a lot of movement is the one you move. But when a chiropractor adjusts it, we actually put a hand on certain area to move specific joint according to your need. Now, you go to us to figure out what joint is not moving, what joint lock up, and then we try to move that joint. Because without movement, the spinal joint do not get food. But you don't have pain just because the joint doesn't move. But what happens is you shorten that joint's life. They suffocate and they're not eating, so they are dying. But during that process, you have absolutely no pain. That's why so many people now have spinal arthritis, spinal degenerative disease. 30, 40 years ago, that number was way lower. But now, all the sitting, when you sit, the pressure on your spine is tremendous. And that's why, but when it's compression, you have no pain. By the time you have pain, sometimes it's too late. And then that's why when you have pain and you go and see somebody like us to treat, it takes time because we have to release all that tension and all that lockup in the joint for years. All right, so after all that's met, let's do one bonus question for you guys. I often have patients come in and then after we get x-ray, they have arthritis to their spine, and I was like, hey, why do you wait so long? And I was like, well, I didn't have pain. And then I have patients where they have severe arthritis and they get frustrated by the time we saw on x-ray, and they said, how come I don't have any symptom? Well, remember, most of the joint that we're sitting, compress your spine, is break up slowly through time. So it's just prematurely. Most of the joint problem we have are prematurely wear and tear. That's why when you have something that you do it every day, you don't feel it because it's not hurting. Just like if you put the pressure on your arm and you slowly push in, it doesn't hurt, but you do it long enough, you're gonna bruise yourself. Same thing with a lot of spinal degeneration. It's only just like you slowly break the brakes in your car, slowly wear down. You don't have any problem until that brake pad completely gone. And you quickly. But the sad thing is with brake pad, you can have new brake pad. With your spinal disc, when they slowly shrinking, you don't have any pain. But when the disc is gone, it's gone. You don't have new and spare part. Only 10% of our entire nervous system are pain. That's why most of the diseases that kill people are not hurting until it's too late. Same thing with joint pain or spinal pain. So don't wait to see a chiropractor just because you don't have any pain. Just like why you go to the dentist every 6 months? To make sure your teeth work properly, make sure your teeth don't rotten. Well, how often you use your teeth? 3, 4, 5 times a day. How often do you use your spine? Every single second of the day. So why don't you have them check out? You go to your family doctor to have your blood test or yearly checkup. When was the last time you checked your spine out? And remember, your spine is your central nervous system. Maintain your spine. Take care of it so that they last as long as they can for you. All right, so thank you very much for watching. And I know it's just a few myths I answered earlier, but I can assure you that you have a lot more questions. So if you have anything that I didn't address above, please feel free to put a comment below. Anything you heard about chiropractic, about myth, about what we do, I'm more than happy to answer them. And then also, if any topic that you like to hear that I can address, put the link, put the comment below, and I'm more than answer to reply to you guys as soon as I can. And hope that helped. And thanks again for watching.